Audible, Inc. presents The Narcissistic Family, Diagnosis and Treatment, written by Stephanie Donaldson Pressman and Robert M. Pressman, narrated by Karen White. Introduction. The Focus. The Narcissistic Family is a book written by therapists for therapists. It is for those brave people who, on a daily basis, engage patients in that mysterious, private, and sometimes beautiful struggle we call therapy. The authors are two therapists who have worked in the trenches, the moderately comfortable, moderately soundproof rooms where hopeful patients and hopeful therapists are placed together for about an hour at a time. Like many therapists, we have struggled with patients who have been refractory to treatment. We look for books, workshops, and words of wisdom from our colleagues with hopes of finding the answers as to why the impasses exist and how to overcome them. The most helpful information for us is inevitably action-oriented. The reasons and the theories are fine, but we want to know how to apply them, what to do behind those closed doors, how to help the client. This book puts forth a new viewpoint in working with a puzzling and difficult patient population. It does not give a new diagnostic category. However, it does suggest a common thread that ties together individuals who, depending on the day they are interviewed, might otherwise receive a diagnosis of a variety of personality disorders, borderline, overanxious, narcissistic, paranoid, and dependent, or clinical syndromes and disorders, multiple personality, dysthymic, and post-traumatic stress. Moreover, the narcissistic family model provides a framework for therapists within which they can help individuals who share this common thread. A broader view. Links between the experiences of childhood and their sometimes permanent effect on adult behavior have long fascinated observers of human behavior. Of particular interest has been the impact of one's family of origin on personal development. In the last decade, the concept of the adult child of alcoholism, ACOA, has helped us to understand the nearly predictable effects of being raised in an alcoholic family system. As therapists, many of us have worked for years with individuals suffering from what appeared to be immutable low self-esteem, inability to sustain intimacy, and/or blocked paths to self-understanding. The concept of the ACOA opened a new door to the understanding of such problems. Therapist authors such as Wojtitz, Black, Gill, and Bradshaw, among others, have drawn vivid images of how children's personalities are molded in a special way by alcoholic families. The literature produced on this topic has cleared a much wider path of recovery for children of alcoholic parents. It has also increased the sensitivity of therapists to the impact of alcoholic rearing on personality development. At one time, therapists seldom asked directly about the drinking patterns of the patient's parents. Now, such questions are routinely explored in initial assessment interviews. Of late, a new body of literature has been created. Books written by abuse survivors, both to focus attention on the devastation caused by physical and sexual abuse, and to give validation and guidance to other survivors, whether male or female. Laura Bass and Susan Davis have articulated the trauma of sexual abuse, as well as techniques helpful for recovery, in a landmark text, The Courage to Heal, while Stephen Grubman Black was among the first to attack the myth of male invulnerability to sexual abuse in a poignant narrative, Broken Boys, Mending Men. In fact, many bookstores now offer more self-help books for various types of survivors than they do for dieters, heretofore a staple of the paperback publishing industry.
Sample complete. Ready to continue?